If you or someone you know were suffering from a stroke, would you know what the signs are, what to look for? Dr. Andrew Ducre, he is an endovascular neurosurgeon from Barrow Brain and Spine, and he's here to teach us the signs of a stroke. I was alarmed. 1 in 4 people don't know the signs.
Yes, it's oftentimes
That's crazy.
Oftentimes a stroke can be a dramatic event, but sometimes the signs can be very subtle. Sometimes the symptoms can come on and go away. And so it's very important to recognize these signs and to really take action, seek medical attention.
Right, and I think I said it wrong. Only 1 in 4 recognize the signs, I should have said. They recognize the signs. So what are they? What should we be looking for?
Well, so I really like the American Stroke Association's FAST campaign. It's a mnemonic to help us identify the signs of a stroke. So F is for face. So basically, a face should be symmetric. If you see asymmetry on the side of a face, or if when you smile, there's some abnormality on one side of the face, that may be a sign of a stroke.
Okay.
A is for
arm.
Arm. So
okay.
You ask the patients or ask the family member or a friend to raise their arms up, and if one arm doesn't hold up as well as the other arm, that could be a sign of a stroke.
Okay. And C is speech.
Well, S is for speech.
S. Okay.
And so if you encounter someone who's having trouble coming up with words or garbling their speech, or they're not understanding you, then that may also be a sign of a stroke. And,
okay.
and T is for time. So if any one of those F, A, or S basically are abnormal, then it's time to seek medical attention.
All right, so FAST. I like that. Face, arm, speech, time. So we got to look for all of those signs. So when patients come into Barrow with stroke symptoms, what techniques are you all using there?
So there's a number of things we can offer for stroke patients. The traditional technique, if you get to the hospital fast enough, is for us to administer a medication in the vein. It's called tissue plasminogen activator, TPA. It's a clot-busting agent. So basically, if you can get there fast enough, we can administer TPA. It can dissolve the blood clot. It can open up the blood vessel to the brain and improve the symptoms. But this doesn't always work for some blockages that are too large, or if the patient gets there too late. So the other technique that's really becoming more important, especially after a number of positive trials that we had in 2015, is endovascular treatment. So I actually brought a couple of little examples of some of the devices we use. So this is a small catheter. We call it a microcatheter, and through a catheter that we place in the patient's artery in their leg, we're able to track this microcatheter over a wire. And this microcatheter we take actually up into the blood clot and across the blood clot. And once we do that, this is what's known as a stentriever or stent retriever.
It's very fine on the end, the
It is
fibers
very
there.
small, very fine, and specifically designed that we deploy this across the blood clot in the brain.
And this is what we're looking at right here?
Well, exactly. So on the left side, basically, we see a cerebral angiogram, and you see that the blood vessel on the left side of the screen is cut off, and that's the blockage in the brain. And after we deploy and withdraw the stentriever, on the right side, you see we've restored blood flow to the brain.
Wow. Dr. Ducre, who's most at risk for stroke?
So there's a number of risk factors for stroke. Some of them we can't do anything about. Older patients, unfortunately, are at higher risk for stroke, but thankfully we have the ability to modify the majority of risk factors for strokes. Patients who have heart arrhythmias, specifically atrial fibrillation, and patients with high blood pressure, high cholesterol, diabetes, or those sorts of other medical issues are at highest risk. So it's obviously very important to be seeing your primary care provider and to be on the right medications to keep these risk factors under control.
And at Barrow Brain and Spine, of course, at the forefront of research and technique for stroke intervention and prevention, and we appreciate you. That was very insightful information. We want to give you some information now if you feel you could be at risk. Here's some contact information for Barrow Brain and Spine. The number to call, 602-406-8450. They also have a website for you. It's barrowbrainandspine.com.